Yeah, well, this is a debate over gender-affirming care, which you'll recall has been a big issue here for a few years. Now, 2 years ago, state lawmakers approved the SAFE Act banning that care for minors. That included things like hormone treatments and surgeries. Then Governor DeWine vetoed it, saying it was bad for children's mental health. Those lawmakers overrode that veto, and in March, it was blocked by an appeals court. Then 3 weeks ago, Ohio's Supreme Court voted 4-3 to reinstate it. So you got a little ping-ponging action back and forth here. And now on the federal level, these cuts wouldn't be coming from a law, but a budget.
The bill is passed.
Donald Trump's big, beautiful bill, one step closer towards becoming a law, but not without some pushback.
The budget that's being proposed is a bit scary for social service organizations.
The House GOP plan proposes cutting federal support for Medicaid by nearly $700 billion over the next decade.
As always, President Trump came in at the end to bring all sides together and get this deal done. The One Big Beautiful Bill protects the Medicaid program and its benefits for the most vulnerable Americans that the program was designed for.
But some opponents, like Kaleidoscope Youth Center here in Columbus, argue LGBTQ people are overrepresented in nearly every program the budget cuts.
Why would anybody want to actively harm another human being by cutting off their medical support?
One provision strips all Medicare and CHIP funding for gender-affirming care, including puberty blockers, hormone therapy, and surgeries. Another bans coverage for these services under the Affordable Care Act by excluding them from the definition of essential health benefits.
The bill has things that actively attacks the LGBTQ plus community, that attacks things like DEI, just things that have nothing to do with finances and budget.
Data from the Williams Institute at UCLA School of Law highlights that LGBTQ adults are nearly twice as likely to rely on Medicaid as their primary source of insurance. In Ohio, 11% of LGBTQ people don't have health insurance.
Make it make sense, right?
Columbus City Council recently approved a $265,000 for Kaleidoscope.
At a time when state and federal policy is actively undermining the very existence of our LGBTQIA+ friends, neighbors, and loved ones, I firmly believe that when state and federal policy fails, our cities must lead.
But none of this goes towards clinical or behavioral services.
There's always a threat of funding loss, which is why, we as an organization are trying to be more strategic about where we're getting those funds from and kind of looking towards community support.
As this bill now hits the Senate floor, opponents are encouraging lawmakers to reconsider, arguing if federal funding decreases, all Ohioans, not just LGBTQ people, may not have the coverage they need.
Maybe bringing a little more compassion to the laws that we're trying to write.
The big, beautiful bill now heads to the Senate for approval. And if all chambers, 45 Democrats and 2 independents, vote against the bill, 4 Republicans would also need to vote against it in order to defeat it. Now, here in Ohio, we're going to take a look at the Senate here. Bernie Moreno is expected to vote for it, but John Husted wrote this on Instagram before it was approved by the House. The big, beautiful bill is a necessity because it cuts $4 trillion in taxes that otherwise would go up on the American people and small businesses. On your side in studio, Kirsten Lindquist, ABC 6 News.